Are you living in pain? Is it joint pain or muscle pain? If so, stay tuned. Welcome to Living Pain-Free with Dr. Marc Darrow, MD, and Dr. Thomas Grove, DO, from the Joint Rehab and Sports Medical Center in West Los Angeles. This is the program that can give you effective solutions for the pain you've been living with. Dr. Darrow is a medical doctor board certified through his studies at UCLA, and Dr. Darrow uses stem cell and platelet-rich plasma to heal your body. He teaches about the use of stem cells, PRP, and prolotherapy. Dr. Grove is a regenerative medicine specialist and an expert in ultrasound-guided injections with extensive experience as an athlete and strength and conditioning coach. Today's program could open up a new life without pain for you. To speak with Dr. Darrow and Dr. Grove, call 866-870-KRLA. That's 866-870-5752. Ask for a copy of Dr. Darrow's book, Stem Cell and Platelet Therapy. Regenerate, don't operate. Now, here's Dr. Darrow with his co-host, Dr. Thomas Grove.
Hello, everyone. I'm Dr. Thomas Grove. Dr. Darrow's away from this week. We are very excited to talk to you today about regenerative medicine. This is living pain-free. So what we do, I am a physician. I'm fellowship trained in sports medicine. What we do is non-operative treatment, right? We try to heal the body using the body's natural healing cells. We use things like platelets, called platelet-rich plasma, and your body's own stem cells. What we do is we take those cells, we concentrate them down into small syringes, use small needles, and I use what we call an ultrasound. Those are my eyes, so we can actually guide that needle directly where we think we need to get some healing going. From there, we keep you out of the operating room, hopefully, right, by actually healing the body from the inside out. So instead of using things like pain medications or steroid shots or numbing shots, what we do is we take the healing cells of the body, inject it into certain areas, whether it's a knee joint that has some arthritis in it, maybe a shoulder that's got some rotator cuff tears in it. I inject head to toe, so the entire spine, small joints of the fingers and toes, almost all ages. I think last week I had a teenager, and then I had someone I think that was in their late 90s. So this is amazing tool that now we know a lot of these elective surgeries we don't think need to be done. What we can do is actually heal that body from the inside out. So it's a very exciting time to be in regenerative medicine. I truly think I have the best job on the planet. It's super fun to get people back in the game and back to work and back to moving again. But I want to give you guys an opportunity to call us live here in the studio. We can talk about any of your aches and pains, any of your orthopedic or musculoskeletal injuries. That number to call us live is 866-870-5752. That's 866-870-5752. We'll give you a copy of Dr. Darrow's book, Stem Cell and Platelet Therapy, Regenerate, Don't Operate. Again, the idea there is we inject these healing cells of the body, get some regeneration going, right? If we put it into a ligament, a tendon, a soft tissue structure, or even a joint, we actually now know with lots of really good level 1 research, randomized controlled trials with humans that we can regenerate tissue, and even on a microscopic level, right? If you take little samples of that and you look at it under a microscope, it looks more like that healthy tissue that it did, previously leading up to that injury. So it's an amazing tool. We're just kind of using the body's own healing system, and we supercharge it by concentrating those cells and delivering it right on target where we want to get some healing going and speed up that healing time for you. Again, nowadays, those elective procedures, things like, meniscectomies, if you have a meniscus tear, or some of these rotator cuff repairs, we just don't think are totally necessary today. We've come a long way in musculoskeletal medicine. So again, a very exciting time to be here with that. I'm going to give you guys an opportunity as well to get a free consultation with our staff over the phone. That number to call is 800-300-9300. Again, that's the number for a free consultation with our staff over the phone. We've got our staff waiting by right now. We're at 800-300-9300. Really want you guys to check out our website. Every day I get texts and I get emails, and patients are asking, well, where's the research on this stuff? What do the procedures actually look like? And I always direct them back to the website, very well put together. That is www.jointrehab.com. That's www.jointrehab.com. We have got endless studies there. We've got lots of good videos of us doing these procedures. Hopefully take the fear out of what this actually entails for you. And again, with regenerative medicine, we've got a couple of different options nowadays. So PRP was definitely something that was showing a lot of promise many, many years ago. That's called platelet-rich plasma. Lots of great research coming out every week with that. What we do there is a simple blood draw, like you're given a blood test. We take that blood sample, we spin it down in a machine called a centrifuge. What that does is it isolates down and concentrates down all those good growth factors, exosomes, platelets that are floating around in our blood. These are what we think have to do with the healing process. So we're concentrating those down. We leave behind the red blood cells. So PRP actually has kind of a yellow or gold color. From there, we can, again, put it into a small syringe, look with the musculoskeletal ultrasound. Again, not the ultrasound that heats tissue up, right? This is the ultrasound that allows us to actually see the tissue in real time. Again, I'm super, super lucky to have, been starting my training using ultrasound and how far it's come since then. Nowadays, the ultrasound is actually higher definition than MRI. And the huge benefit we have with ultrasound is I can do what we call dynamic evaluations compared to a static image that you would get from an X-ray, a CT, or an MRI. Static meaning, the patient, right, you, is not moving. Right. So if you ever had to do an MRI and you're moving around too much, right? A lot of times that radiology technician will say, yep, you got to do it again. You're moving around too much, right? So with ultrasound, I do dynamic evaluations. So what we can do is actually look at that tissue in real time, right in front of you. We're both looking at the same screen as we do it. And it can reveal a lot more information than a static image. So especially when you're looking at things like, tendon or ligament tears or even meniscus tears, I can put some force to these areas and actually see, do we have maybe some instability or extra stretchiness to these tissues that might indicate that you have a tear compared to if you didn't have tension on it, just from a static image, like when you're laying down. So a lot of times MRIs miss a lot of things. We talk about it every week as well. We think about what the reality of the situation is versus your pathology. So we say reality versus pathology. So what that means is, if you come in and you have your MRI results and you see some things that aren't completely normal, for example, things like in the spine, we see this every single week. Almost everyone's coming in with an element of a disc bulge or maybe some stenosis, maybe some degenerative disc disease, maybe some facet joint arthritis. There's just so many studies out nowadays looking at people that have no symptoms whatsoever. We image their backs and we find these things in the majority of our patients. Same thing if I'm looking at somebody's knee, I'll see things like meniscus tears or partial meniscus tears, but they don't have any symptoms at all. So we really don't want to jump the gun just because we see something on an image. We want to make sure that we're correlating that with what your reality is, meaning, what sort of symptoms are you experiencing? And if I'm actually doing a physical exam in person as well, we should be able to reproduce some of those symptoms in certain injuries to put a more clear picture together. We have a very important aspect of putting a care plan together, and that's the physical exam. I stress the patients every single week, especially when they're already scheduled for surgery or they are considering a surgery, to make sure that they're getting somebody who's putting their hands on them. We don't want to have a surgical decision strictly, based off of an image, because what that leads to is someone having an unnecessary surgery, which is what we're really passionate about. Is surgery should be the last line of defense for a lot of these injuries. Certainly surgery is needed for a lot of things. If you get in a big car accident, you get a bone sticking out of your arm, what have you. Those are things that certainly you don't want to wait on that one. Certainly go to the surgeon for those sort of things. But we're in the elective surgery realm, meaning these are surgeries that you choose whether or not you need to have them. They're not emergent, meaning you don't have to have them in an emergency situation. So it's a very important aspect to try to put that whole clinical picture together, right? Making sure that you're having a physician that can hear your story, right? You have a proper physical exam. I had a couple of patients yesterday that were very thankful. They kept saying over and over again, I'm like, I'm so sorry, I have more questions. And I encourage them to ask those questions. I really don't think of my job so much as, a physician, just more of an educator. So I want to make sure I'm laying out all the different treatment options that you have available to you so you can make an educated decision. And I take with me my experience that I had, as an athlete, as a strength and conditioning coach, working with professional athletes for many years internationally. Best sports nutritionist, sports psychologist, right? Weight loss specialist, Western medicine, Eastern medicine, former medical school. I've trained all over the place. I was in Nebraska, and then I was up in the Pittsburgh Then I was down in Dallas, and I was in Virginia. I was doing rotations all over the country, trying to find, the best minds, the best hands that get the best results in both the surgical and the non-surgical fields, right? Surgery is very, very important, certainly. And when we talk about things like surgical options, I want to have at least a base level and understanding of, what they're looking at doing. And just the problem we have in our system a lot of times is going to be the speed at which that you have to make a decision. So a lot of times if you're an orthopedic surgeon, unfortunately, you're very rushed through your day. You've got very little time with your patients. So a lot of times the patients leave that appointment, not quite knowing, number one, what's wrong with them. Or what the proper care plan is that they put together for them, or if they decide on having a surgery, what that surgery really means. How long does surgery take? What sort of recovery time do you have from that? So a lot of times patients will come to me and ask those sort of questions, which can be frustrating because that's something that is tough to get through in 5 or 10 minutes with a patient. So really, I say it almost every week. I'm so thankful that I have time to talk with my patients so we can get to know your story, get to know what your goals are, do a proper physical exam, right? Do a good ultrasound scan on you in real time, and we can really try to put together what we think is the best care plan for you and lay out what your options are. Again, PRP is a great option. Draw your blood, spin it down, inject it back in. Even better than that, we have something called stem cells nowadays. So these are a much more efficient way of healing the body. Way that we get those for you is what we do is we do something called a bone marrow aspiration. Sounds big, bad, and scary, but it's really not. What you do is you come into the clinic, we numb up the back of the pelvis, use a small needle, go in, pull out some of your bone marrow. Bone marrow is a very rich source of your body's stem cells, also has some platelets in there, so no need for a blood draw if we do a bone marrow aspirate on you. From there, we can spin that down, inject that back into the joints, ligaments, and tendons, wherever we think that your pain generation is coming from. From there, what we do is we give you a little offloading period. So, for example, if we inject a knee, right, we want to make sure we're giving you a good period where you're not going and beating yourself up, not the time to go on that long hike or do a real hard set of resistance training, squats, lunges, things like that. After we inject, what ends up happening is those cells create an inflammatory response. So you might have a little stiffness or soreness, which is really the side effect that we have our patients expect. Again, not much compared to the side effects potentially, right? These complications from big surgeries, things like paralyzing nerves, or if you have a big blood clot, or if you had a bad experience to anesthesia. The beauty of what we do by using injections is we don't have to subject our patients to those sort of complication risks. So it's a much faster recovery. After you get over that initial soreness, maybe a little bit of stiffness there, we bring you back into the clinic and we see, how your progress is. The field of regenerative medicine, it's not, 100% an exact science, meaning I can't tell you, hey, listen, after X amount of injections or X amount of days or weeks, you're going to be back to 100%. I wish I could, but again, we're very, very honest with how this stuff works. Sometimes you need a couple of rounds, right? Sometimes even different types of injury, the same patient. I've injected myself over my body. Sometimes you'll have, 1 or 2 weeks that go by. You feel pretty good. Sometimes you're going to have maybe a couple of months that go by before you actually feel a little bit better with that. So I always say stay as patient as you can. Be in a position where you can take it one day at a time, right? Sometimes people get better quickly. Some people take a couple of rounds. It's really just a matter of, time and how many injections that you need before you start to feel better. And again, I wish I could guarantee things, but sometimes you need a little bit more time. There's a couple reasons why some of the regenerative medicine that you might get somewhere else might not work. Pretty frustrating when people will go in and get a regenerative medicine treatment, and then they will come back to me and say, hey, I don't think this stuff really works. I just want to get a second opinion. And then I ask the question, hey, did you have an ultrasound used for these injections, especially into things like joints? And they'll say, no, I didn't have an ultrasound done. And I think, well, maybe they just didn't get the cells where they wanted to go to actually heal the body. So that's really important that you use ultrasound. It's a technology that, in my honest opinion, you got to be up to date on if you're going to be doing musculoskeletal injections. It's a great way to not only diagnose the body, so I can use it to look at the tissue, like we discussed earlier, but you can actually use it in the interventional component, meaning I'm guiding my needle using minimal damage, right, using small needles, to put those cells on target, put you in the best position to heal, right? And again, if you don't have the training in this sort of things, we call that sort of bad doctor syndrome, right? If you're just, randomly injecting, you don't quite know where you're putting your stuff. not surprising you don't get the best results. Again, if you're using too much exercise, that could be another reason why you don't have the best recovery or the best results from regenerative medicine. Another big one is going to be the post-care instructions. So if you've got somebody who comes in and you do a regenerative medicine injection, and you're somebody who takes a lot of ibuprofen, maybe some Motrin, meloxicam, Aleve, Advil. These are what we call NSAIDs, or non-steroidal anti-inflammatory drugs. These are medications that actually block that initial inflammation that we need to jumpstart the healing process. So we always encourage patients and tell them, hey, listen, when we really want you to hold off on those medications, allow your body to get that inflammatory response to really optimize your healing, right? So it's definitely something that we know that can limit some healing. Same thing with oral steroids, things like prednisone. So maybe you had a respiratory infection or something like that, and you're on a prednisone pack. That's something that we'd ideally want you to, to finish up before you come in, especially high doses. We know will limit some of that healing that you get. Another big one too, again, if you're not using ultrasound and you're injecting a joint and you're not looking for something called a joint effusion, that's a really big red flag. So a joint effusion, for example, on the knee, you ever heard of things like water on the knee? What can happen is the body will respond after initial injury, whether that's, an ACL tear or a meniscus tear or just a flare-up of your arthritis pain, your body will put a lot of fluid into the joint. And when that happens, if you want to treat it with regenerative medicine, really what you want to do is do a joint aspiration first. What an aspiration is means I put a small needle in, actually pull that fluid off. The reason for that is you don't want to water down your treatment, certainly. So I'm big on reading research. I'm big on, what are the next things that are coming out, how I stay, ahead of the curve and give my patients the best care. And a lot of these studies, they won't even use ultrasound, or if they do, they won't mention, whether or not there's an aspiration there. So it's very, very important that, we're looking for those sort of things that might limit somebody's healing. Very easy to do. Again, I just, I'm injecting in the same area. I'm just pulling that fluid off first to make sure we're in a better position for you to heal. I'm going to give you guys an opportunity to talk to us live here in the studio. You can talk about yourself, give us a fake name if you like, a loved one maybe, about any of their orthopedic or musculoskeletal injuries. Number to call us live, 866-870-5752. That's 866-870-5752. We're going to give you a copy of our book, Stem Cell and Platelet Therapy, Regenerate, Don't Operate. We even pay the postage for you there. Lots of great studies in there, lots of great case examples, some detail how this stuff works, right? Regenerative medicine, using platelets and stem cells to heal the body. We'll give you guys a free copy of that book. And then if you'd like a free consultation with our staff over the phone, that number to call is going to be 800-300-9300. That's 800-300-9300. Again, free consultation with our staff over the phone. And again, a great resource for you. You want to check out some more research, check out some videos of us doing these procedures, right? Read up about, what we've done and where we've been. We're at www.jointrehab.com. That's www.jointrehab.com. Really awesome on that website. There's a spot on every page to shoot us an email. We really pride ourselves on being available. We give our cell phones out to all of our patients. Again, the website's a great opportunity to get to us as well. We're answering emails morning, noon, and night every day. We're very passionate about this work. A lot of people, unfortunately, just don't know about regenerative medicine as an actual option for them to put them back on their healing journey. And after they have an injury, a lot of times that first consultation will be with an orthopedic surgeon, which typically is going to result in a surgical part of a care plan. So ideally, what we're trying to do is get you, another set of eyes on you and see if we can get you where you want to go without doing further damage and actually heal that tissue from the inside out. Again, the whole idea is we're using the healing cells of the body to heal from that key issue, from that main area that you're having your injury. Again, using a proper hands-on physical exam, really guiding and diagnosing with ultrasound as well if we need an image to see what's going on, because again, you are not your image. You come in with an MRI. We don't necessarily have that same diagnosis when you leave our clinic because we want to be a little more thorough, get a proper history, physical exam, putting some hands on you, putting the ultrasound on you, and seeing exactly where we think your symptoms are coming from. And again, we inject head to toe. I do the spine, I do the neck, the mid-back, the low back. I do all the extremities as well. Again, using the ultrasound, you can really inject into these areas that otherwise are a little bit dangerous to inject. So as I guide my needle in, I can avoid, vital structures. I can avoid, nerves and different vessels. So it's an amazing tool that we're able to use. I had a fun case yesterday of somebody who came in with a pretty bad wrist sprain. They ended up having a fall after playing some basketball. And it was like 6 months or so, and things weren't getting better. They tried the medication route. They tried some physical therapy. Things weren't really helping themselves out. Didn't really see anything on an MRI. And so when they came in and I did a physical exam, I had an idea, I think, what was going on. And then you put that ultrasound on. They had a little tear in one of the tendons on the pinky side of the wrist called the extensor carpus ulnaris. Also had a little tear in something called the triangular fibrocartilage complex. That's a mouthful. It's called TFCC. This is going to be a set of connective tissues that connect that pinky side of the forearm to that first row of your hand bones. Pretty common injury that I've seen in, like our racket sports players, so, like your tennis players, things like that. This is somebody who just unfortunately had a bad fall where the hand was kind of deviated or moved towards the pinky side of their wrist. And again, that was one of those things that no one looked for it, and they didn't really know exactly what was going on with this person. They went conservative, which I'm not mad at that. This is somebody that, again, using a guided injection, we got him some great relief. Again, the whole idea is you got to know where to look. You got to properly stress that body with a physical exam and figure out where you think your problem is coming from. But ultrasound is such a game changer. The injections can certainly be painful if you don't know where you're going. A lot of nerves, a lot of vessels, a lot of structures, and things like the hands and the feet. And this is somebody who had a very pleasant experience with us because, again, I can aim with that ultrasound. I use a tiny, tiny little needle. For this one, I could use a little 30-gauge needle, much smaller than a flu shot. Size needle. We just introduce that needle directly into these areas that need some healing. Again, put some of those cells in there, give it a little offloading period. For something like that, we can use maybe a little brace to kind of remind them, hey, we don't want you, putting a whole lot of force to these structures as you go back to work next week. We bring them back in 2 weeks and do a follow-up appointment. Again, the beauty of what we do after you do an injection, no need to take a ton of time off or anything like that. You walk into the clinic, you get your injections, and you walk out, which is pretty neat compared to surgery. So we got a lot of people, they'll come in even on their lunch break. They'll come in, get their treatment, and go right back to work afterwards. So it's a pretty amazing tool that we have at our disposal. Using injections, right? We can get some PRP going, we get some stem cells going, we get some healing compared to doing things like surgery. So it's a very, very fun time to be in sports medicine. I'm very blessed to have some of the best training in the world from some of the best mentors. And again, the idea is you're exposing yourself to different ideas, right? Not only the operative side of things. I spent thousands and thousands of hours in the operating room compared to the non-operative side of things. And again, I'll be honest with you, I haven't really seen much that can heal, the body's tissues better than, using its own cells, right? Using the platelets, using those growth factors, using the stem cells to introduce some healing to an area. And again, it's not super complicated stuff. We just take those healing cells and put them where we think we need to get some healing going. But the idea is if you heal your underlying issue, right, hopefully we're going to have success, maybe getting you off some pain medication, getting you back to getting some mobility back, right? So pretty common scenario where someone will come in with an injury and maybe they put some weight on, right, because they can't move their body around as much. Now that'll affect, the rest of their life as well. Maybe their energy is not as good. Maybe they're having trouble sleeping. Maybe they're not performing as well at work as they'd want to, which can trickle over into your personal relationships, so on. So it's a really amazing role that we can play in people's lives to get some tissue healing, get that body moving again. I had a really, really tough case a couple weeks ago with someone who had some bad post-concussive pains. This is someone who got in a pretty nasty car accident. You're a year past, that initial injury, and you're still having bad neck pain and headaches. And this is something that, they went through all the conservative routes first, acupuncture, chiropractic, some manual medicine there. So, and then they're on a lot of medications that try to help kind of dull or blunt that pain signal. This is somebody who had some really great results with some injections that they did with me. Talk about that here coming up after the break. Again, I want to give you guys an opportunity to call us live in the studio, 866-870-5752. That's 866 870-5752. Give us a call, free consultation over the phone, 800-300-9300. That's 800-300-9300. Check out our website, www.jointrehab.com. We'll see you after the break.
You're listening to Living Pain-Free with Dr. Marc Darrow and Dr. Thomas Grove. Their practice is located at the Joint Rehab and Sports Medical Center in West Los Angeles. To schedule an appointment, call 1-800-300-9300. That's 1-800-300-9300. Dr. Darrow and Dr. Grove will be back in just a moment. Stay tuned.